Hello, everybody. It is 1 o'clock, so we're going to start on time, even though it seems like we're missing quite a few registrants, but we want to make sure we stay on time. My name is Peter Gudaitis, and I'm the Executive Director of New York Disaster Interfaith Services. And this webinar was written through a partnership between the Interfaith Center of New York, represented by Henry Goldschmidt, who's on with us this morning, and the Office of Thrive NYC, represented by Kala Ganesh, who's also with us this morning. So we were asked to develop a module regarding mental health and faith communities and our needs during this pandemic. But a majority of the material in the toolkit, which can be found at this link that you see on your screen, is evergreen material on mental health best practices and needs here in New York City generally, and what resources are available through the Office of Thrive NYC, which is an office of the mayor's office. Our speakers this morning are going to introduce themselves in a minute. If we could just advance the slide. I want to thank Thrive and the Interfaith Center and acknowledge also the work of Father Stephen Harding and the Reverend Dr. Storm Swain, who wrote the pandemic content for this curriculum, and you'll be hearing from them in a minute. Slide. You should keep yourself muted, preferably, unless you are speaking. But you can use the chat feature at the bottom of the screen. You'll see a little bubble that says chat, and you can type questions or comments into that box throughout the webinar, and one of the moderators will pick up on that question and hopefully get to it as soon as is appropriate. Slide. So I'm going to introduce Father Harding first, and he is going to introduce himself, and then when he's finished with his workshop on the toolkit, Dr. Pilar Jennings will facilitate a panel discussion with Anandita Chatterjee Baumik from Boston Evening Therapy, who is a Hindu practitioner, and the Reverend James Lynch, who is also on the call. He is the president of the Buddhist Council of New York. So without further ado, Father Harding.
Thank you, Peter. Before I start, though, I believe we have a message from Susan Herman, right? So we'll start there.
My name is Susan Herman, and I'm the director of the Mayor's Office of Thrive NYC. Thank you for joining this webinar on faith.
Sorry. We'll get back to her. My fault.
My name is Susan Herman, and I'm the director of the Mayor's Office of Thrive NYC. Thank you for joining this webinar on faith and mental health. Thrive promotes mental health for all New Yorkers, and we do this by closing gaps in care so that people and neighborhoods who have gone underserved for too long can access support where, when, and how they need it. But we know that when you talk about promoting mental health in our city, you need to talk about faith communities. We know that faith leaders listen, counsel, and help heal psychic wounds. And we know that your congregations turn to you for guidance and support. For the last few months, when so much uncertainty, sadness, and grief have been layered onto New Yorkers, your leadership has sustained so many. And we thank you for being there for your congregations. We're also grateful to our partners at the Interfaith Center of New York and New York Disaster Interfaith Services. Together, we offer you a toolkit with suggestions and resources to use now during the pandemic and for years to come. We hope that today's conversation will be lively and informative. Thank you for all you do to promote mental health and spiritual well-being in our city. And thank you for taking the time to be with us today.
So my name is Stephen Harding, and I am the rector of Grace Church in Vineyard Haven on Martha's Vineyard. But before I got here, I was actively involved in New York City's faith community. So, and part of it. What we're going to do for the next 19 minutes is to look at the context that we're in, and welcome and thank you so much for being part of this webinar. We're going to look at our context that we find ourselves in. I want to tell you what this toolkit does. I want to show you how it can work for you. I want to tell you the four most important things in it. And then I want to end up with providing referral resources for you. And then we'll answer questions as time permits. So that's the program for the next little bit. So I want to start with something that happened when I was serving as a volunteer chaplain with the American Red Cross after the September 11th attacks. I was in one of the family assistance centers as a volunteer chaplain, and a woman came in the door, and I happened to be close to it. So I went over and I said, "How can I help you?" And she said, "I'm here because of my 8-year-old son. He told me that I had to get out of bed and get help." And I looked at her and she said, "I've been in bed with my head under the covers ever since the attacks. And my son is insisting that I get help. So here I am." So I asked her if I could introduce her to a colleague, and she said yes. And I brought her over and introduced her to one of the mental health professionals, introduced them, and then went back to seeing who else would come in the door. So I tell you that story because for a number of reasons. One, every disaster has its own life cycle. It has typically a beginning, the event, the aftermath, what happens right after it, short-term recovery, weeks to months, long-term, months to years. You learn from it, you get ready for the next one, and then when it hits, you're ready to go. So on this scale, my woman was right here, close to the event, right in the aftermath stage. This other thing that looks, or slide rather, that looks like a heartbeat shows the emotional trajectory of a disaster, right? You're going along I'll move to get rid of it. You're going along, the disaster hits, and then everyone acts heroically and then falls off an emotional cliff into disillusionment. And the woman that I met was right here, I think. So it's important to know where the person is in the context of what we're dealing with. Now, this looks a little chaotic, and it is because we have not one, but two pandemics going on. We have the COVID-19 one, right? So somewhere we're in disillusionment at this point, I think. But at the same time, somewhere in the disillusionment of the COVID-19, we also had the murder of George Floyd and everything that's happened since. So now it's possible to be somewhere, maybe here, in the racism pandemic that's sweeping our country, and at the same time be somewhere else on the COVID-19 pandemic. So it's possible to be in two different places at the same time for two different events. And it's confusing. And all the mental health challenges that existed before COVID-19 hit, they're still with us, right? But since then, all of the pre-existing realities are magnified. There's increased stress due to social distance, unemployment, risk if you have to go to work, decreased access to care, and multiple losses of people, of jobs, of routine spaces, all those things. So when you talk to someone, what you really want to know is where they are and how long they've been feeling like this. So this slide is actually the most important thing in the toolkit. You're looking for length of time and for acuity of symptoms. So my woman at the trade center, she was 3 weeks after, so we had time. And we had acuity of symptom in that she was hiding in bed with her covers over her head, and her 8-year-old son had to come get her out and tell her to get help. So acuity of symptoms and length of time will guide your response. So it's normal to feel stress in COVID-19 conditions, right? Feeling anxious, lonely, or sad are common reactions. And my woman at the Trade Center Family Assistance Center, I don't know that she was any of these. But the next step, and all this is in the toolkit, is acute stress, where the symptoms carry on for a significant length of time. There's nothing actively causing them. The symptoms of stress are magnified and/or are experienced for most of the day, and they begin to affect a person's ability to care for themselves or to be in relationship with others. And this woman meets all these three criteria. Signs of traumatic stress are the next phase in this. And panic, constant hypervigilance, losing touch with surroundings, and all these things, I don't know if my woman meets this because the amount of time clinically for these to be classified as signs of traumatic stress, you need between 3 and 6 months after the event. And in working with people, especially when multiple pandemics are going on, you really have to know where your limits are. You have to know when you're in over your head and it's time to make a referral. So this is the second most important thing to know, is know when you've reached the end of your limit. And that's where this toolkit it works, because it provides a guide. It details all the signs and many of the symptoms on the cognitive, mental, emotional, spiritual, and physical domains. And acute traumatic stress, but then it also tells you what the risk factors for traumatization are, ethnic and racial minority groups, proximity to sickness, death, and other traumatic experiences, multiple traumatic experiences, persons with chronic medical illness or mental health challenges, or older people, or people who are in group facilities or nursing homes. And I'm just going through some of what's in the toolkit with this slide. But one of the things in the toolkit is secondary trauma, and this can affect all of us because as faith or community leaders, we may be at risk for being traumatized just through being exposed to family, and or alternatively by being repeatedly not able to be with those who are dying or their families. In other words, not able to do what we think is our job. So keep an eye on how you're feeling. And if you are experiencing any of the former criteria, then maybe it's time just to say, wait a minute, how am I? What do I need? Where do I need to go talk to someone? Because secondary trauma is real. And we included these pictures of Dr. Laura Breen on the left, an emergency room physician, and EMT John Mandello, who worked for the New York City Fire Department as an EMT for about 3 months. Both of these caregivers took their own lives, and we put them in to make this real and to honor their lives and their service. Because the stress it's real, and it can have a cumulative effect, and caregivers are at risk, us, faith leaders, community leaders, are at risk for secondary trauma and all the effects that we help others deal with. So understand where your limits are, where your training stops, and when it's time to make a referral to somebody else. The third most important thing in this toolkit is to know when to refer. And this is the same slide as the slide that we had way back with acute stress, where the symptoms of stress go on for a significant length of time without any cause, where they are experienced for most of the day or are magnified, and they begin to affect a person's ability to care for themselves or be in relationship with others. When to refer is key. And this toolkit tells you, it gives you the guidelines to follow. How to refer to a mental health professional? It's not, what I did with the person that came hiding in her bed was I asked her permission. I said, could I introduce you to a colleague who I think can help you? Got her permission, and I walked her over so that it wasn't just go see this person over there, but she felt cared for. So you let the individual know that you care about them, explain why you're concerned and why you think this is a good idea, that they go see someone who can help them. I worked with a rabbi, Mordecai Katz, who was wonderful. And I was on duty for my hospital as chaplain, and I got a phone call from one of our chaplain interns saying that she had a woman call and ask to say goodbye on a Saturday afternoon to Rabbi Katz. And my chaplain intern was smart enough to realize that this was not a normal call. And she got the woman's number and called me. And I said, Rabbi Katz, it's Shabbat. He's not available to talk until the sun goes down. So could she please wait and call him then, or have him call her then? And we'll see what's going on. Well, it turns out that the woman was actively suicidal and was calling Rabbi Katz to say goodbye before she took her own life. She waited, she understood about Shabbat, And she waited until he could call her. He called her, found out where she was, said, "Stay there, I'm coming to see you." Met her where she was, persuaded her to come to the hospital, brought her to the hospital, and waited with her until she was admitted. And that level of care and concern is part of the referral to mental health. If you have the option and it's not actively suicidal, then present different possibilities and resources. It's always better to make the referral to someone you know or that you've worked with. But if that's not possible, we have resources coming up through NYC Well that can be helpful to the individual and to you. And then the last thing is to assure the individual that you will continue your support until the referral's complete. And it's not like you're handing them off and you never see them again. It's like, this person can help you more than I can for this. And I will be there when you need me. And follow up, call and say how'd it go. So here's the fourth most important thing, which is the resources that you have to refer people to. So NYC Well, you can call them, you can text them, you can go to their website, and which looks like this, actually. I don't know, it'll be in the slide packet, but their web address is in the search bar, and they have filters. It's like, how can we help you and with what? Are you a first responder? Is this HIV/AIDS related? Are you homebound? And that's just a partial excerpt of their filters. Then there are others for age, payment information, what borough are you in? And then it provides resources. And Helena mentioned last time that if you call and you ask for the crisis team, they respond very quickly. Other helplines to call are the National Suicide Prevention Lifeline, the Domestic Violence Hotline, the National Alliance on Mental Illness, and the Substance Abuse and Mental Health Services Administration. And obviously, if you have someone who is actively suicidal and threatening to harm themselves or others, you call 911 immediately, and help will arrive very soon. That is my very quick run through of the Mental Health Toolkit. In addition to signs of stress, suicidality, secondary trauma, how and when, and the resources, there are also sections on grief, complicated grief, moral injury, and self-care for you, the faith and community leaders, so that you also get the resources you need to continue to care for the members of your communities of faith. So thank you again, and I am now turning this over to the next speaker. Thank you so much.
Thank you so much, Reverend Harding. This is Pilar Jennings, and I am participating today to help moderate a discussion. I'm a psychoanalyst in private practice here in New York City, and I also teach Buddhist studies at Union Theological Seminary and the Nalanda Institute, where we explore the clinical applications of Buddhist meditation. And we're going to transition now into a panel discussion. And we have two participants and presenters. And I will ask you both to introduce yourselves briefly, and then I will begin with some questions. And so perhaps, Anandita, would you like to begin by introducing yourself?
Thank you. Good afternoon. Thank you for hosting this. My name is Untitled Chapter. I'm a clinician. I am a certified trauma specialist and also an active member of the Hindu community, both here in Boston and in New York City. My experiences with the community goes back many, many years, both with the faith and the lay community. Doing domestic violence and clinical work here. Just excited to hear what the resources are and what we can do for our community members. Thank you for the opportunity.
Thank you, Anandita. James, would you like to join us and introduce yourself?
Yes, thank you very much. My name is James Lynch. I'm the current president of the Buddhist Council of New York. I'm also the representative for Risha Kosakai, which is a lay Buddhist organization which does a lot of work with the UN. And in my professional capacity, I'm the chairman of the business department in Brooklyn College, when we teach things like negotiation and happiness in the workplace.
Wonderful, thank you. So to start us off, I'd like to ask a simple question and would love to hear from both of you. If there is a message or a theme in the Toolkit workshop that particularly resonated with you, and I'm sure there are many, but if there's one that really seems to speak to your experience, we'd love to hear. So perhaps Anandita, would you like to begin, and then James?
Sure. So in my clinical capacity, I also head a team of clinicians here in Boston, and it's called Boston Evening Therapy Associates. So one of the biggest things that when I looked over the toolkit was like self-care. So this is something that has come up for us a lot because we are hearing almost 24/7 how people are hurting, how people are suffering, what they're doing in order to cope or lack thereof. So self-care and trauma, both primary and secondary trauma, vicarious trauma for the providers and for the people who are going through it, that absolutely resonated with me. And the most important thing, I feel like the isolation that we have all been facing, both as providers and as lay people or devotees, we are not being able to connect with one another as we originally did. So there is a lot of separation going on, and particularly for survivors of domestic violence, that isolation leads to further trauma and a feeling of entrapment, which exacerbates the experiences of trauma. And so that is something that resonated very well with me, and the resource page where, you know, people can actually look up a place where they can send their devotees or anybody they're working with, or someone who just approaches you. And you know, even though I'm Hindu, I do get calls from other community members who are non-Hindu members, but they are looking for support, both clinical and otherwise. And so this is immensely helpful for us to guide them to a place.
Thank you so much. James.
Yes, no, thank you very much again. I think that the toolkit resonated, first of all, the idea of helping others. The whole toolkit itself is the action of us helping other people. And one of the things that the gentleman had said before, the idea of not just leaving someone who's in distress, but to actually engage them, reminds me of, from my practice, of compassion. And the whole idea of compassion is not simple empathy or sympathy, but to be engaged with the person to try and remove their suffering. So therefore, you don't leave the person in isolation and things of that nature. I also agree that the idea that struck me about the clock, which was really important, is the idea of impermanence. You know, a lot of times we get locked into thinking that the suffering or whatever condition we have is going to be permanent. But what I thought was really interesting is that the idea of a clock lets you know that you're going to go through stages, and it's all right to go through those stages and to experience those stages, but to know that they're impermanent in their manifestation in your life. And that also helps the person who's trying to help someone else, because they don't have to try and force them to get out of the stage. They can allow them to naturally move. And if you see that they're needing of dramatic help, you can get them professional help with them. So those are the things that immediately struck me with regards to those things, with regards to the toolkit.
Thank you so much, James. You remind me that sometimes there's a balance between affirming the suffering that we're hearing about, but also offering some reassurance that it's dynamic, right? That while people might be suffering acutely, this does not mean that they're going to remain stuck in it, especially if they get skillful support and response. Thank you. So another question, and this one has a couple of components. If you could speak to one or two successes from your perspective and one or two challenges that you have faced in supporting the emotional difficulties of your congregations, and perhaps how would this toolkit help you in any of those challenges?
So for me, it's a little bit different from a lot of you guys because, again, Hinduism is not really that organized as a religion. Yes, we have the big temples, which I am also part of, the Hindu Temple Society of North America and the Sadhana Coalition and, you know, the Vedanta Society of New York. I'm part of them, but also at the same time, there are other various institutions that are all over New York City. Like, for example, the Divya Ram Temple in Queens, the Bangladeshi Hindu Mandir in Queens. There are little organizations where multiple people go in, and I am not sure how connected they are to the mainstream and how much resources they are able to access given the limitations, because the language becomes a big barrier. I understand that we use interpreters and there are multiple languages that are spoken if we use language line and whatnot, but at the same time, just to go somewhere when you're in distress and to seek out help and then to be able to find the language that you speak, it's just a little bit of a challenge for people. And also, the biggest challenge that I am noticing is that, you know, the toolkit at some point, you know, from my readings talk about the elderly and the isolation. A whole lot of people would generally go to the temple once a week and meet up with friends or connect with their priest, and that is not happening right now. So most of the temples have been closed. So even if they wanted to reach out to somebody, that would be really, really difficult for them because now they're trapped inside and they are not going out, particularly for the senior population within the Hindu community who cannot access those resources outside, right? So those are the challenges that I have been experiencing. And the successes, you know, there are people who have gone out and who have made an attempt to reach out to the people, especially those who have not shown up to the temple services, to call them and to figure out if they need any help. You know, I have to say this, here in the outskirts of Boston, we have a temple where, you know, we decided we are going to have a drive-through darshan, or, you know, you can view the deities driving by and collect prasadam, the offering. So that means food was delivered. And at some point, the priest, actually, he doesn't call himself priest, Keshav, went from house to house delivering food. And I have urged many faith leaders, particularly priests in the community, to talk about the resources that's out there. And what you're talking about, holding space with compassion and with empathy, it becomes a little bit challenging when you do not have that regular connection, because in the temple, people come maybe once a year, twice a year, a few times a year, but they are not regular parishioners as you might see in other faith-based organizations. So that is a huge challenge. But the success story is this, that we have been able to bear witness, to hold space, to talk to people about death and dying, about, you know, and also assuring them that this too shall pass, for a lack of a better word, and also that, you know, we go through these sufferings and we come out of it. Nothing is going to stay with us permanently. We will learn, we will grow. But
that every life is important. Black Lives Matter has an important role to play. That we're not demonizing anyone because of their race or skin color. That the goal is to uplift all of humanity. Those are the things that we're trying to do. I think so. Those are challenges going forward.
Thank you so much. You're raising so many critical points, and one of them that I'd love to ask you both about before we open it up for Q&A and larger conversation is the likelihood of re-traumatization that's happening now for so many people in our communities. And I'm wondering if, and I know James, you were just alluding to it, but if you could both just speak to the complexity of helping people understand that they have been re-traumatized, that prior traumas have gotten activated through the current COVID crisis and the brutality of police, white supremacy that is coming up in civil unrest, and how to help them understand that that really deserves treatment response. So I'm wondering if you could both speak to that experience.
James, would you like to go first?
No, I want you to go first. That's why.
Thank you. So in the South Asian community, just like many other minority communities, there is this stigma about mental health. So really people do not really like to talk about it. Even very recently, as of day before yesterday, I would get phone calls when I'm home, but if I'm in the temple, they will not ask me questions about their experiences or what they are are facing regarding trauma, and also pre-existing conditions worsening because some of them have not been able to go see their providers and or get help. So many have been avoiding the hospitals. And not everybody is lucky to have private insurances and have telehealth. So, so that is a bigger issue. So they can't go there, they can't get the medication, and they are not willing to speak up in public or in front of others about their mental health issues or any of those kinds of questions, which I understand, and I would not even address anything because of HIPAA, but still they would not bring it up in person. And the other challenge that they are experiencing, particularly people who have fled their countries of origin because of any kind of war, any kind of atrocity, and because of practicing their religion in certain parts of the world, and they have come to the US. And I'm very respectful of law enforcement. I'm a former NYPD clergy liaison, so my gratitude to law enforcement stands. But the fear has now quadrupled within the immigrant community with regards to law enforcement. And I had a harder time to convince them before to call 911, and now it has just become impossible for many of my survivors to pick up the phone and call 911, whether it is because of COVID related or mental health related, because now they feel if the police comes, they might be attacked for calling 911, especially somebody is belligerent because of a schizophrenic or a psychotic attack, or they are going to be looked down upon because we do not stay clean or whatever, or live together in a small house with too many family members and just spreading germs. So it's just like the fear has quadrupled in our community, to be honest with you, and they are being re-traumatized. And unfortunately, they do not have the language to articulate that experience or the trauma that they're going through, and for a lot of us, at least in the Hindu community, a priest is a person who does the ritualistic offerings and oftentimes then does not connect with the devotees who come up. So there is that void. So somehow we lay leaders in the community go in and try to do the work, but that needs to be done even more right now because of this fear for the law enforcement. And people do not understand, they will say that, oh, I understand, they help us, they do all kinds of nice stuff for us, but the fear is absolutely palpable.
Thank you so much. James.
Yes. I just, to take a step back, about 4 or 5 days ago, I did a Dharma talk for people of color here in New York City and around the country. So many people are on the edge. People are not aware how hard it is sometimes to remain engaged into their communities when they feel that the community may be hostile to them. So the trauma is real. I mean, that's a very difficult question that you're asking, because some people, I was just listening to the eloquent speaker right before, and she talked about, about calling the police. And I remember I lived in New York City, and there was a case many, many years ago called Eleanor Bumfer's case. It was an African-American woman who the police called, and they shot her hand off with a shotgun, something like that. And she had a mental illness. That was way back in the 1970s, probably before most of the people were alive, but I was there. And the policing in New York City has definitely gotten better as with regards to those types of concerns, but there's still this underlying tension that people are having. They're almost in a, James Baldwin used to say, to be black and conscious in America is to be in a constant state of rage. And so people are constantly being re-traumatized by images that they see. I don't know if some people saw a woman of color. I think she may have been a Hispanic woman. She was taking her young daughter on the subway, and they tackled her and they knocked her down and arrested her in front of her daughter because she hadn't pulled her mask up. And people were screaming, she has her mask, she just didn't pull it up in time. And people don't think about that, but from my perspective, that's re-trauma. Everybody who sees that's re-trauma, because people frequently, of color, frequently when they go on the subway, they are concerned that some artifice or, you know, minor issue is going to be blown out of proportion. So in our community, what I think we've tried to do is to have what I call safe spaces, and even bring the safe spaces to people. So we've done a lot of, like everybody else on the call here, the fact that you're here on the Zoom call, we've done Zoom reach out and outreach, but also at the same time, there's a large portion of our population which doesn't have computers, who don't have those access. So that was one of the reasons why I said earlier on, we've tried to create safe spaces so that the monks can actually go into that community, be safe, and provide solace, and where necessary, get them to get official help where it's appropriate. You know, but there is you know, it's not smooth, it's not easy. I mean, we're doing the census with NIDIS and things like that, and they can tell you Venerable Nakagaki is doing out there. It's not easy, it's hard. It's hard work that's being done, but it's a good question.
Thank you so much. And now, since you've both offered us a great deal to consider and reflect upon, I'd love to open it up for some Q&A. And so what I would ask is, if you would like to speak or you have a question, just unmute yourself, and then you can remute after you have spoken to the group. So Kala, would you like to start us off?
Yeah, thank you so much, everybody. Anandita, hi.
Hi, Kala. Good to see you.
I know. So I just wanted to say that, you know, for NYC Well, the mobile crisis team that earlier had been spoken about is a good resource for immigrants to understand that, you know, when the mobile crisis team comes out, that is not police, those are mental health professionals. So of course, it's not for somebody who obviously needs a 911 call, but certainly, you know, someone who hasn't gotten there but needs a crisis team to come and evaluate, that is an option to consider, because they are staffed by mental health professionals who can come there in about 24 to 48 hours and actually assess the person. So just to know that people who are worried about their documentation or the police, this is an option to use.
Yeah, that's great.
Thank you so much. Are there others who'd like to respond or ask a question? Is it Prabha? Right.
Thank you. Thank you all for this resource. I don't live in New York. I live in Pittsburgh, Pennsylvania. And so I'm delighted that I can participate in this extraordinary community that you have created. My question is about what is available. And I used to be a therapist. I'm now a peace builder. I run an international peace building organization. And so my question is about the fact that our practices are all trauma informed. And so we come across, my apologies, people in so many different contexts. But when I practiced as a clinician, we did a lot of training for faith leaders. And my question is about what you know is available. I would love to share this with all of the faith leaders in my community, and also see if there is any possibility that you could hold something like this for the people in Pittsburgh. It doesn't have to be here. That's one. The other is, as Anandita said, amongst Hindus, our priests are not practitioners and community builders in the way that those of the Abrahamic faith are, right? And so I get a little bit concerned when at every interfaith gathering, people try to approach the priests, because that's neither their training nor their practice. So really raising the awareness amongst others of how then do the lay people step forward, and what can they do with the support of the clinicians in the community are questions I'm pondering as we're beginning to do more and more of this. And there is as we're talking about multiple layers of trauma, it is not just the pandemic, it's the role of those who are witnesses. The model minority carries its own guilt of standing by. I watched after Rodney King as no Indian leaders stepped up, and it's very different now, fortunately. So there is that facilitation of conversations that needs to happen. So it's, I guess, not just the mental health. I'm also thinking about the preventive and community building aspects of what you all do that you might speak to about resources. Thank you.
If I may respond to that. So the one thing I have always done in my lifetime in New York City, and I am forever grateful to the Interfaith Center of New York, Chloe, Henry, and everybody else who was involved, Sarah. So, you know, one thing what we had done and what I had done always, so I am actually a devotee in multiple mandirs, temples, societies, as you call them. So you basically embed yourself in the congregation and you make yourself available, known to people that, you know, people can, you will get some backlash that is given, you know, so I have been called all kinds of names, that's fine. But then, you know, you will have that resource that, you know, if they are really at a jam, they will call you, even the temple organizers will call you. And mostly insidiously, you will get referrals for people who need the services. So I think, you know, this has worked for me beautifully in New York City, and it still does in Boston, that you really have to become part of the community and go in. And you know, we have our challenges, and the reason why we become model minorities and do not speak up even when we are dealing with trauma personally, and as a group we don't speak up because we want to protect what we have worked so hard for. So going in with an understanding, going in with reverence, and becoming part of them is the first step. And then you can also reach out, I would say, and Henry, you can correct me if I'm wrong, to Interfaith Center of New York. They have wonderful resources, you know, Faith Trust Institute for domestic violence resources. So there are multiple places that you can actually reach out for some sort of support. Thank you.
Thank you so much, Anandita. Did anyone else want to respond? Kala, did you want to respond to that?
One thing I would say, just one quick thing to say, is that in the context of the Buddhist Council, what we've been trying to do is, as it's said, create bridges between other groups. So our sub-theme is New Culture of Peace, right? And it seems more needed than ever before. So some of the things we're trying to reach out to other groups to create peace teams so that we can work with other faith traditions to go to hot spots and to create places where safety can be moved to those locations. So working with other people is crucial.
Can I just follow up with that? Is that okay, Kala?
Oh, yeah, please.
Thank you. It's a small group. So thank you so much, James, for mentioning that, because what we are finding is, as people are increasingly isolated, obviously, amongst the most influential are their faith leaders. You know, as it gets increasingly divided, we as peace builders who are mediators and peace builders are reaching out to the faith community to say that the messages that people are getting from their faith community really needs to support what we are all trying to do. So I understand this is not purely about mental health that I'm speaking about, but it contributes to it. I think it contributes to health and wellness when the messages from the peace community, from the faith community, are also about the kinds of collaborations that are possible with healers in other practices. So thank you for mentioning that.
Kala, did you want to jump back in?
Yes, I just wanted to say that, you know, part of how the toolkit came about is our initial conversation with faith leaders on this nexus of, you know, mental health and the role of faith leaders, and mental health education for faith leaders in the community, both natural leaders who come about and they're not mental health practitioners, but they are somebody that people turn to. So that's part of how the toolkit came to be, in partnership with all of us. And we did have a roundtable discussion, which unfortunately happened just before COVID, but with the multiple faith leaders from various faiths to really look at mental health, education, availability, and ways in which we can partner. So that sort of will continue, hopefully, and lead to where, Prabha, you wanted to lead, which is like, education.
Thank you so much, Kala. So we have about 5 minutes for a few more questions or comments.
This is TK Nakagaki. I'm sorry I got pretty late. Sorry, because I tried to get in, but then this one says, the sales is over. I mean, ended. So every place I went is sales ended today. So I don't know. I think more people should be able to come probably if that's not the case. So Henry sent me the another click, so I was able to come later on. But I'm sorry I missed so many parts of it. I just wanted to say I'm just very grateful for both of you. I mean, for a long time I haven't seen Sister, Anita. I can't pronounce your name always, but regret it. And so the James represents the Buddhist Council. I'm very glad that he was able to do a lot of things nowadays. So I just wanted to thank both of you to join. So, but the simple question is that sometimes I feel like East and West is very different in terms of this. And even actually, I realized this time for the coronavirus, I cannot say it loud, but some of the Buddhists feel like this is very easy. Because they feel more, this is, I don't have to worry about the activities, but, coming activities, the mind is actually very nicely, arranged this time. So I just wonder what do you think or what you felt? And is that something to do with, in terms of general mental health, what is it that mental health is responding to that, this kind of a feeling? I shouldn't show too much of joy, but I mean, it is joyful in one way. Thank you.
Thank you. So perhaps we can just have one brief response and then Peter will be helping us end the session for today.
Hi, I'm Venerable Yuan, and then I see Harry and then Reverend Chloe and TK and James. And first time I met Anita and then Kala. Our temple is in Flushing, Queens, and Reverend Chloe came over before. We have a quite big congregation, but during this past 3 months, or half years, the pandemic, and actually in our congregation, everyone seems very calm and peaceful because they all well know and learned from the Buddhism's teaching is that impermanence. There nothing will stay as always as forever. So that when the impermanence is just like the wave, they always will have some up and down, up and down. The most important thing is what they have learned, the wisdom from the Buddhism, the teaching is how you deal with when the situation come up, and how you deal with your inner peace. So as long as you can remain you're mentally peaceful, and then you can see through, you can see through, you knew this is impermanent. You won't lock down yourself, stay home forever. It's just temporarily. So everything is temporarily, and then you always have expecting some changes to happen. But you have to well prepared, and then get yourself, during this past 3 months, and then we are running a lot of classes online, and then teaching online, and then everyone's getting prepared, and then they treasure the time they can do a lot of practicing, and they can save a lot of traffic time. Like before they have to go to work, but now they all save all those time. They can do self-practicing, self-cultivation. So we always learn to see through the different side of the things. When the things, the scenario, the problems come up, we got to see different side of it, see the bright side. So in our congregation, everyone so far, as what we know, they remain pretty calm and then peaceful, and then they also get ready to get back to whatever they can do. Thank you.
Thank you so much. And I know that Peter is going to be winding down. And just to respond, I really appreciate the challenge of both bringing in the healing arts of a particular religious tradition, while also having some curiosity about acute mental illness or extreme signs of stress or trauma that are in need of additional forms of support. So I thank you everybody for participating in the conversation.
Thank you.
Thank you.
Peter, I hand it off to you.
Peter, right?
Thank you all for being with us today. This session was recorded and it will be made available online. Somebody shut off the PowerPoint too early. We will be posting it on YouTube as well as making it available through the Interfaith Center and Thrive NYC. And I'm sure we'll continue conversations with Thrive about future opportunities. I do think it's important for us to name the challenge that global faith communities that speak many languages and come from many cultures are extremely challenging for simplistic solutions. So it's so important that we have these conversations in an intimate setting like this versus just a public open webinar where anybody can get on at any time. I think the exchange is critical for us. But I also would encourage all of you to certainly reach out to the Interfaith Center or to NIDIS, my colleague Helena, who's on with us today, so that we can continue the conversation about how we can make mental health best practices available to leaders within the global faith communities of our city that speak, again, so many different languages and come from so many different cultures. In a city that, despite its diversity, is still predominantly governed and led by the white English-speaking Christian community. And so how do we do that in a way that helps mental health best practices and resources feel accessible, but also how do we develop the capacity necessary in the provider community to have practitioners who speak indigenous languages, that have religious literacy and competency as our mental health providers. No diaspora global community can be served without that language access as well as that cultural and religious competence. And so that dialogue needs to be ongoing. Having people like Kala at Thrive are certainly helping, drive that conversation forward. As much as James reference to the heritage versus convert communities that exist in all global faiths, like Buddhism and Islam and Christianity and so forth. So again, thank you for participating in the conversation. We hope to have more offerings in the future. We hope the toolkit feels accessible. If it's not yet available in a language you need it to be in, then please feel free to reach out to me, Henry, Helena, or Chloe, and we can work with Thrive NYC to perhaps get some translation of those resources available to the leaders in your communities. You will be receiving an evaluation from Helena to just give us some feedback on what was helpful or not helpful. We hope that you'll take the time to fill that out, and thank you for being with us today, and be well.
Thank you so much, Peter. Thanks, everyone.